Oh, there we go. We got the announcement that said recording in progress. Thank you. My name is Brittany Grooms, and I'm with Family Connection of South Carolina, and I am the Director of Home Visitation. I work with the PAT and which is our Parents and Teachers program, and our Project Breathe Easy program. So we are very excited to get all the information and have all our questions answered, and just have a good time learning more about just best practices and things when we are talking about our little people when it comes to COVID. So we have Miss Cynthia Lara. She is our Director for Childcare Licensing. And then we also have Dr. Debbie Greenhouse, who is from Palmetto Pediatrics. So we are happy to have them both helping us out today and being our resident and certifiable experts on all the things. So I'm going to go ahead and turn it over to Miss Cynthia Lara, and she's going to get started with her presentation.
Hello, everyone. I'm going to share my screen so you can see my presentation. Put it in presentation mode. Well, do you all see my screen or no? Is it black? That's what I see too. Let's see what happened here. Now, of course, you know, it worked earlier, so we're just going to look at it this way and call it a day. All righty. Excuse my notes and things on the side. But my name is Cynthia Lara, and I'm the Director of Childcare Licensing with the South Carolina Department of Social Services. I'm not exactly sure why it won't go in presentation mode, but here we are. So I just want to let everyone know that childcare facilities around the state are monitored and inspected by my staff via a set of regulations to protect the health, safety, and well-being of children who are receiving care in childcare facilities. And so childcare licensing enforces these regulations to ensure compliance. Well, how do we ensure compliance? One of the things we do, annual inspection visits. And so after we go out every year to a particular childcare facility, and every childcare facility, and make sure that they are in compliance with the regulations. And then we also enforce the regulations by making complaint visits. If we receive a complaint, then we go out unannounced. We kind of, go out and don't let them know that we're coming. So we go out and we will inspect to ensure that they are in compliance with the regulations. We will investigate the complaint that either the parent has sent in, that we got off of Facebook, Instagram, TikTok, Twitter, that maybe law enforcement has called in to us, or fire marshals have called in to us, or even zoning officials may have called in to us. Or we will even do inspections that we get from anyone in the community regarding a childcare facility. And so there are 4 regional licensing offices around the state that report to me. And each one of those offices have a set of childcare facilities that they are responsible for issuing licenses, conducting inspections, and investigating complaints. We have the Upstate Regional Office, and that is supervised by the regional supervisor, Lori Moody, and her team is responsible for all of the child care centers, churches, schools, and family child care homes in those counties that you see listed on the screen. There's also the Midlands region. April McDaniel is the regional supervisor, and she and her team are responsible for all of the child care centers, churches, schools, and family child care homes in those counties that are listed on the screen. The Midlands region is probably one of the biggest regions in the state because it has more counties that her team is responsible for monitoring. Then we have the Low Country, and Stacy Turcott is the regional supervisor for that area. And her team is responsible for all of the child care centers, churches, schools, and family child care homes in those counties listed in her section. And then there is the PD region. Peggy Wilson is the regional supervisor, and her team is responsible for all of the child care centers, churches, schools, and family child care in these counties that are listed in her section. So I also just want to talk very briefly about the guidance that South Carolina DHEC has provided for child care facilities across the state. And so the COVID guidance for child care facility, this gives child care facilities guidance on preventative planning and then what to do when there are cases of COVID-19 in the child care facility. So one of the things they want child care facilities to try to do is physical distancing. Well, we know that that is harder to do with young children, and therefore any children and staff in a classroom with a case of COVID will be considered a close contact and will require quarantining unless the child care facility was able to practice some sort of physical distancing between all of the caregivers and the children in the classroom, because their recommendation is, if feasible, children should be spaced 3 feet apart. Then there is cohorting. Now, cohorting means keeping the same children and staff together throughout the day, limiting any interaction outside of that group. So if you have group A, which the teacher for that, let's say, is Miss Molly, and Miss Molly has 3 children, and then you have group B, and the caregiver is Miss Diane, and Miss Diane has 4 children, then they should remain with their sets of children according to DHEC if they are going to do cohorting. And that prevents any cross spreading of COVID between the 2 groups if they are able to keep them separated like that. The other thing that DHEC recommends is that children have to be excluded from childcare if they have certain symptoms. Now, I'm going to pull up the DHEC exclusion list. All childcare facilities around the state of South Carolina, they have this, and they are aware that they are supposed to exclude children if they have certain symptoms. And so this is what the exclusion updates were that South Carolina DHEC gave to child care facilities. And it just every year they update the exclusion list. And so we'll scroll down, and there is COVID information there that child care facilities must take heed to. And so let's see if I can go back to the presentation. Yes. And so one of the things that is very important if there is a child in the facility or a caregiver, a staff or caregiver that has a case of COVID, the child care facility must report that to the parent and to DSS Child Care Licensing.
Ms. Laura, I'm sorry to interrupt, but I don't think we got to see the list. I think it was still showing your PowerPoint screen.
You
Just
didn't get to see the exclusion list?
Yes, ma'am.
Okay. I'm out of the presentation mode, and that probably has something to do with it. But I will pull that up in just a minute because I'll have to go out of the presentation and share that. So let me get through this. I only have a few more and I'll go back to it.
Yes, ma'am.
Okay. And so here we are now. DHEC also requires isolation of all cases of COVID-19. And that simply means that parents have to be called to come get their children. And so if anyone receives a phone call that says, hey, we were told that a child, they won't name the child, all of that is confidential, a child in your child's class tested positive and your child is considered a close contact and you're gonna have to come get your children. And so that is something they have to do. And they are to notify us when that happens. So they have to, childcare facilities must enforce that. So staff and students who disclose that they have COVID must either stay at home or go home. So there's no in between because childcare, they're not equipped to handle children, sick children with cases of COVID. So you want to make sure that your child is seen by a medical professional. If they are showing symptoms of COVID-19, and if they have tested positive for COVID-19, they must stay home or go home until they meet the criteria for returning to childcare. So things that the facility are also recommended to do is if they had a case of COVID at their facility, they must also clean the facility where the person may have been contagious, may have been while contagious, excuse me. And the CDC has some guidelines regarding that. I'm not gonna show those because I see, since I'm out of my presentation mode, you all won't be able to see that. Oh, sorry. And so there's some reporting places that the child care facility must adhere to. They can either call the DHEC care line, which, you know, they are very familiar because I provided this to all the child care providers across the state. Or if they have multiple cases in a facility, DHEC wants them to call the regional health department because they want to really get a handle on the number of children in that facility that may have tested positive for COVID in case there are other things that they need to do at that facility. So, and again, those must be reported to the parents and to DSS Child Care Licensing. So I want to share this picture with you to kind of give you an idea as to what the guidance means as it relates to those who may have close contact. So as you can see in this picture, everyone 3 to 6 feet of the child of the case in the middle, that is a positive case. All the other cases, they have on a mask. They're within, some of them are 3 feet, some of them are 4 feet away, and there's even one that's 5 feet away. Well, everybody in this scenario is a student, And if all students who are potential close contacts in a class or cohort are wearing their masks and are at least 3 feet apart, then only the person with a positive case needs to isolate according to DHEC. Okay. All righty. And then here is another scenario. The positive case is in green in the middle. So we have the case that's off to the left that says not a close contact because he's 3 feet away. The 2 foot person's close contact, that person has to quarantine. The one that's 4 feet away, that's a student. That student has to quarantine. The one that's 2 feet and no mask, that student has to quarantine. But look, there is another student that is 7 feet away from the positive case. That student does not have on a mask and does not have to quarantine according to DHEC. So these are the kinds of tools and guidance that is given to childcare facilities across the state so that they are aware of the expectation that they should notify parents when there are cases of COVID in their facilities, and they have to notify us at DSS in childcare licensing. The other thing I do want to do, and which means I'm going to come out of this and go into our website. It's just that we have a website, if you all aren't familiar with it. Let's see, stop sharing this. And start sharing this. This is the home page of our website at scchildcare.org. And on this website is a variety of information. There is information for providers, and there's also information for parents. And you can scroll through here and find whatever you may have some questions about. Additionally, there is information on here about COVID childcare assistance. There is information for providers that involves another COVID support grant that the agency has out for childcare facilities right now. There's information about the SC voucher maximum payments, which are allowed in fiscal year 2022, that has been updated. There's CACFP information. Oh, excuse me. There is a state plan draft in case anybody wants to see that. There is the market rate survey. This is specific to a child care provider. But then here is the list here of the CDC and the DHEC information regarding COVID for child care providers. There's the guidance for child care providers and the guidance on management of suspected and confirmed COVID cases. And so just so you know that when I get this from South Carolina DHEC, I email this information to providers so they get it timely. And usually it only takes me a day or two to get it emailed to them. As soon as I get it from DHEC, I send it right out. And then I put it on the website for everybody to see because that's public information. So I wanted you all to see that. And I want to see if I can get the exclusion list up because I knew I wanted to show that. And helpful resources. I don't know if I can get to the actual exclude. Well, this is the information about the exclusion list. Here is the, oh, I'm sorry. That is in Spanish for those of us who may speak Spanish. And then there it is in English. That was what I was trying to show you earlier, but was unable to. And this is just the updated 2021 exclusion list from SCDHEC regarding school and childcare. If children have any one of these that's on this list, then they cannot attend school until it has been resolved. And there's a lot of explanations about those things. And so the list begins here. COVID is on here. Another thing that is new that is on here, and I think Dr. Greenhouse, and I'm sorry, is going to discuss it because I'm not going to, is RSV. That's new. And I think that is also on here. And so that kind of, this you can find on DHEC's website at scdhec.gov, I believe. Yeah. Okay. I'm going to come out of this. And that concludes my presentation.
All right. Well, I wish we could give you like a loud clap of an applause, but that's what we'll just have to do. So we're going to hold for questions right this moment. I know y'all got some burning questions, so just tuck them away for a second. And we're going to go ahead and introduce Dr. Debbie Greenhouse, and she's going to give her presentation, and then we're going to come back and have those questions that you all are desiring to ask.
Good evening, and thanks for joining us. So having listened to that great presentation, I think what I'm going to do here is just try and tag team onto that and talk a little bit about, in these scenarios of excluding kids and kids being exposed, who gets tested, how do they get tested, when do they get tested, what test are you using, and then to some degree, when do you have to retest, if you have to retest, to determine when they can return. And I know I'm sure there are set criteria for return to school and daycare. What we have seen in the real world, however, is that each school and each childcare somehow seems to set their own guidelines as to when the kids can return. And some of them make a lot of sense. Some of them, quite frankly, make no sense whatsoever. But we do the best that we can with those. And from my perspective, I think each school and each daycare is a little bit different. So to some degree, I think they should be able to do what works for them within the realm of good public health. So in these settings of children being exposed in childcare, the first thing I would say is that I wholeheartedly agree that in a small room with a bunch of toddlers moving around all over the place, I think it is to some degree impossible to determine who are your close contacts, who is within 6 feet for more than a 15-minute period of time in a 24-hour period. I mean, toddlers are all over each other. That's just kind of a thing. So I think it's perfectly reasonable to say, yeah, all of those kids were probably exposed. They're under 2, they're not wearing masks. There's just not a whole awful lot you can do there. So in that scenario, the kids have been excluded, they are quarantined. When do you test them? The current guidelines would say that you can test a child who has been exposed immediately upon knowing that they're exposed, but then you should test again no earlier than 3 to 5 days after the exposure. That 3 to 5 days is targeted really more towards the vaccinated person. So that's mostly in childcare settings, that's going to be the staff. Because obviously none of the children are old enough to be vaccinated yet. For the unvaccinated exposed, again, soon as you identify it, and you might ask, why do you even want to do that? Why do you want to test right away? Well, the reason you want to test right away is because if they're positive at that point, then you can try to contact trace and identify the folks that were exposed to that child. But you also can start the clock ticking on that child's isolation, because you now know they were positive right away. Their 10-day isolation starts then. You also know at that point that their immediate family, their household contacts, are contacts and should be quarantining at that point unless they are fully vaccinated. And that is an important point to stress, because I would hope that the vast majority of staff in our childcare centers are fully vaccinated. And in that scenario, fully vaccinated, particularly fully vaccinated if they were wearing masks, which they should have been in the childcare center, they actually do not need to quarantine. They do need to be wearing a mask for 14 days. They do need to be tested at day 3 to 5. But according to the current CDC guidelines, fully vaccinated folks with an exposure, particularly if they were wearing a mask, do not need to fully quarantine. The kids, especially since you're talking about kids under 12 years of age, the kids absolutely do need to quarantine. So the kids get tested immediately to identify the ones that actually were positive at that point, tested again at day 5 to 7. Now here's the trick in that though. Let's say you have a household contact exposure. So let's say little Jimmy is in room 1 of the daycare and little Jimmy develops COVID, and little Jimmy's sister is in room 2 in the same daycare. Little Jimmy's sister is out quarantined, but her quarantine officially doesn't start. The clock on her quarantine doesn't start until the end of little Jimmy's 10 days. So the sister, she's quarantined for a long time unless she tests positive. So you actually get into this really weird scenario where the parents want their kids to test positive, because then the clock is ticking and everybody gets out of quarantine sooner. In my world, there's still just so much that we don't know about COVID that I really don't wish for that, because not every child does do well with COVID, and some kids do end up having long-term problems. So I don't wish for that. I don't think that anyone should be doing the chickenpox party kind of deal and knowingly exposing folks to kids with COVID or anything like that. It's not a good idea. So that is the scenario on your quarantine and your testing. That child who's a household contact, their quarantine clock doesn't start to tick until the last exposure to the last household contact. So you could have a scenario of 3 or 4 children in the household, and that household is largely shut down, potentially for a month or longer. The exception to that would be if you were able to isolate people in the household. Now, what's the likelihood that you're going to isolate a toddler? Not stellar. That said, if you've got a parent that's positive and one child that is positive, you could conceivably isolate those two together, the other parent and the child who is not positive, isolating separate in a different part of the house, everybody above 2 wearing masks. Maybe. So certainly that is an option to try for, but again, with toddlers and infants, none of that is easy at all. And then wanted to talk just a couple of minutes about what tests should you be using? What are some tests better than other tests? And the answer to that is very definitely yes. For someone who is symptomatic, they actually have symptoms of COVID, fever, cough, congestion, runny nose, upset stomach, vomiting, diarrhea, sore throat. I mean, as we all know at this point, almost anything can be a symptom of COVID. If you have symptoms, then you could really use pretty much any test out there. The antigen tests in that scenario are fairly accurate. The PCR tests, those are your gold standard. Those are the most accurate. But in that scenario, you could use pretty much any test if you're symptomatic, and if you've got it, it's generally going to show positive. But what about all these kids that we're excluding that are not symptomatic? In that scenario, an antigen test, and those are going to be most of your quick tests done at a drugstore and your home tests. Those are antigen tests. In the scenario where you don't have symptoms, those tests generally are not considered accurate enough. So if you get a positive on that test, it's probably real, but you still should confirm it. If you get a negative on that test and you are asymptomatic, that is just not accurate enough to make any decisions on. So the home tests, nobody really knows what to do with the home tests yet. Where the home test could be helpful is if you have folks that are testing very frequently. Then you're potentially going to pick up cases right at the beginning of symptoms developing, or maybe even a little bit sooner, because the antigen tests are most accurate from the onset of symptoms through day 4. So that's your sweet spot for using them. And if you're testing frequently, you're likely to actually catch them at that point. But if you're just kind of doing it haphazardly on folks with no symptoms, there's just not a lot of value in that. And we never exactly know what to do when folks call us and say, well, I did a test on little Jimmy and it was negative, or it was positive, but he had no exposure and I just did it. I would still say in that scenario, we should back that up with a PCR test, and we'd bring them in and do that test in the parking lot. So there really is a difference. For those who have heard about the antibody test, it's a blood test looking to see if you have antibodies against the coronavirus. The CDC strongly recommends you don't use those tests for any decision-making process whatsoever. And we don't use those tests for anything at this point. They really don't help you. They certainly should not make anyone feel complacent and make anyone think that they don't need to get the vaccine if they're over 12. And they certainly shouldn't make anyone complacent and think that their child doesn't need to be wearing a mask or distancing if they're under 12 and not vaccinated. So there really isn't any role for decision making based upon a positive antibody test. I think that's probably most. Oh, I guess the other point that I would say is we need to keep in the back of our head that not every symptomatic child has COVID. There have been all kinds of other illnesses going around in our communities recently. RSV, respiratory syncytial virus, which is typically a winter virus, decided to make a bizarre presentation this summer, and we had this huge surge of RSV clogging up our offices, our hospitals, our intensive care units. We had really sick kids with RSV. I think we are over the peak of that now, and it is dropping back down again, but it was really strange. Also, just a ton of hand, foot, and mouth disease over the last, I'd say, 4 to 6 weeks, and still seeing a lot of that. And some of those kids have been really sick. It's the hand, foot, and mouth is caused by a virus called Coxsackie virus, and there's a bunch of strains of that virus. And sometimes you will just kind of see a run of it where the kids really seem to get sick, and we have seen that this go around. Whether some of that is because everyone was home for a year, so you didn't have any of these things going around, and then now suddenly you've got a new cohort of babies that don't have any immunity to any of these things, probably. But regardless, the timing of the RSV is very strange. The hand, foot, and mouth, not so much. That is typically more of a summer virus. But there's a lot of other stuff out there. So we need to make sure that in a childcare setting, we're keeping the back of our mind, hey, there's other things we need to be watching for here too, not just coronavirus. I think that would be most of the points I wanted to make, because I wanted to make sure we left time for questions.
Okay, well, I appreciate that. Like some more snaps for Dr. Greenhouse as well. I would love for you all, if you have those burning questions, to you can enter those in the chat. If you feel so brave and would like to unmute yourself, you can do that as well. But we prefer you enter those questions in the chat. And so to start us off, one of the questions that I had that came up just listening to what you were talking about, Dr. Greenhouse, with our organization, as you know, we work a lot with families that have a child with a special need or a special healthcare need. So can you kind of talk to us about the children who are most at risk, and then what does severity look like for them? Like when we say they're at risk, what does that mean? If you could give us a little bit more about that.
So we do know that there are certain conditions that do make children at risk for more severity if they do develop COVID. Why some of those things are risk factors, we're not 100% sure, but we certainly know that kids who are significantly overweight have more trouble with COVID. We know that kids with Down syndrome seem to have more trouble with COVID. Kids with hypertension seem to have more trouble with COVID. So there absolutely are medical problems. Severe heart disease absolutely would be a risk factor for severe COVID. So the most important thing there for those kids, obviously, if they are old enough to get the vaccine, then we would strongly recommend talk to your physician about getting the vaccine for them. But the other thing, just like we do with pertussis and with flu, it's really important to create a cocoon around those kids. So everyone around those kids who can get the vaccine absolutely should get the vaccine. Everyone around those kids who can wear a mask absolutely should wear a mask. We should be having those families using distancing as much as possible, good hand washing outside as much as possible, and good ventilation. It really does come down to a layered approach. And especially for those kids, we need to make sure that we've got all of the layers in place that we possibly can to keep those kids as safe as we can until they can get vaccinated.
Thank you, thank you, thank you. Did have a question come in through the chat, and this one is for Ms. Lara. Is there a requirement that child care center staff be vaccinated? Is there info on the SC Child Care website about staff vaccination status, so parents can factor that into their child care decision?
Unfortunately, there is no requirement for staff to be vaccinated. And DHEC strongly encourages that. So we kind of have to take the lead with what DHEC recommends. And their recommendation is that as many staff that can should get the vaccine, but that is a choice that a person gets to make at this time.
Okay, thank you. And I also want to I had a question myself that I wanted to follow up along those lines around information. The different things that you were talking about that are being reported to DHEC, are those things collected somewhere where they're either de-identified or anonymous, that parents can kind of view that information as they're making their child care decisions on, maybe how many outbreaks or different things like that?
No, that doesn't seem, I don't know if DHEC, well, no, let me say that. I do know that DHEC is collecting information. Now, whether or not they can share that with parents, perhaps by removing all of the confidential things. I mean, because usually when, their childcare is reporting to DHEC, they're probably given names, and there's a certain amount of information that has to be held confidential. So we can't say who, we can't say. Now, whether or not they are keeping a report on those, I'm sure they are. I just don't know how that is available to the public. And I'm not sure that that's public information. Now, as far as childcare licensing is concerned, we capture that information as well, as it relates to how many, and we don't capture names, we don't capture, so we're doing it for to try to get some aggregate numbers to put resources into the childcare facility, and also to follow up with them if we see that there is maybe more cases than usual being reported from this facility. So then we start looking like, what are your hand washing practices? Are you guys wearing masks? That sort of thing. So that is something that we capture for internal use and not for public use at this time. Yes.
Okay, thank you. And I am so proud to see all these questions lighten up. So I'm going to take it one at a time. Everybody got the typing fingers on. So the first one I have, I'm going to assume this is directed at Dr. Greenhouse. Is there any point in a child wearing a non-surgical mask that does not stop aerosol viruses?
So yes, there absolutely is. One really nice thing is that we now have a bunch of studies that are basically school studies that have clearly shown that if everyone in a school setting is wearing a mask, and these were not uniform masks, these were not all surgical masks by any stretch of the imagination, the rate of transmission drops markedly. I mean, the description that I've given folks is simply if you've got two little kids standing next to each other and one of those little kids pees on the other little kid and they're both wearing pants, then only one kid gets wet. If the kid who is peeing is not wearing pants, but the kid who gets peed on is wearing pants, he gets a little bit wet. But if neither of them are wearing pants, the other kid gets a lot wet. So it's really the same concept. But that's kind of tongue in cheek, but it's really the same thing. And we really do have good studies now that have absolutely shown that yes, masks do make a difference. There's no question at this point.
Thank you. And I love that analogy. Love it. Because that happens with kids. All right, next question we have for you, Dr. Greenhouse, is if someone goes for a COVID test, how do they know if they are getting the PCR versus the antigen test?
Quite frankly, they'd have to ask. I can't tell you how many folks come into my office and say, well, I had a COVID test 2 days ago at the pharmacy, and we'll ask them, well, what type of test did you have? And they have no clue. So I think a lot of times no one is actually volunteering that information. So you really do have to ask when you get a COVID test on, hey, what type of test is it that you're running? In my office, for example, we have access to a rapid antigen test, a rapid molecular test that is really good, but still not quite as good as the PCR. And then we can send a PCR test out to LabCorp. So we can do any of them, and which we choose to do depends on the situation.
Okay, I'm going to read this next question, but if you can just put a little bit of follow up, and then we'll come back to it. The question is there any requirement? Why is there a requirement to administer other vaccines, but it is only encouraged for COVID? So for that person who asked that question, if you don't mind in the chat clarifying if you're talking about for staff or for who you're talking about as far as like the COVID requirement. So you can give me a little bit of feedback. We'll loop back to it. And then the next question we have for Dr. Greenhouse is, should vaccinated parents of young unvaccinated children that are at a higher risk of health issues, if they were to have COVID, get the booster vaccine?
That's a little bit of a tricky one, simply because of the current approval for the booster. Right now, Pfizer is the only vaccine approved as a booster, and it's only approved as a booster for folks who got Pfizer the first go around. Moderna applied for a booster status and I believe was turned down today. But some of that may be because Moderna's antibody titers are such that they may actually not need a booster yet anyway. So it's a little tricky, right? Right now, the booster is recommended for folks, I believe, over 65, Pfizer, over 65, immunocompromised, underlying disease in adults. But it is not routinely recommended. That said, that is the official FDA party line. That said, if I had a young unvaccinated child with special healthcare needs at home, would I get myself a booster? Which I've already done anyway, quite frankly. Yes, I would. I mean, I would. There's no question about it. If I had Pfizer, I would absolutely get a Pfizer booster at this point, because I would want to do everything I could possibly do to protect that young unvaccinated child who is at high risk.
Okay, and I'm going to ask that we got some clarity on the other question, but I wanted to ask while we're still in this vein, is there a problem with mixing or matching boosters? If I have Moderna, can I get the Pfizer booster?
We honestly don't know, because no one has really done studies looking at that or released data on studies looking at that yet. So it's a little bit tricky. Have there been people out there in the community that have been doing that? Absolutely, no question about it. But do we have data to say this actually provides as good an immune response? perhaps this may actually provide a better immune response. We just don't know for sure yet.
All right. Okay. And so with the other question, the person was asking for school age children, why is there a requirement to administer other vaccines, but it's only encouraged for COVID? So I guess like your regular well child booster
Oh.
shot that everybody needs. So why is it just not the same for COVID?
I mean, I think the one thing I would say at this point is that right now the COVID vaccine under age 16 has emergency use authorization. It still doesn't have the full authorization. And I don't think anyone in South Carolina is going to mandate a vaccine for children that is under emergency use authorization, even if the data on that vaccine looks stellar, which it does. I don't think you're going to see that happen. Do I think it's going to happen anytime in the near future that South Carolina will mandate COVID vaccine? No, I do not. I think it is going to be up to us in the healthcare community to explain to folks just how important this is, to go over the data, to explain to folks how good the data looks, how effective this vaccine is, how safe this vaccine appears to be. And that's how we try and get our vaccination rates up. I don't think we're going to get them up with mandates anytime soon.
Okay, thank you. Thank you for that. So we have a few more minutes for questions, and I see them popping up. So I'm gonna, okay, we're about out of the questions in the chat. If you have those questions, please put them in the chat. One of the things I wanted to ask Ms. Lara is, when you were in your presentation talking about there are some different things that are guidances, and there are some things that centers must do, what parts of those are kind of like recommended where they can choose to follow them or not, or what is regulation where there are some things that they absolutely positively have to do?
Oh, they are listed in the regulation. So it's definitely, written out in the regulation for Child Care Center. There is a place in here that is specific to the kinds of things that they must report. And as it relates to DHEC, the thing it says here is child or staff occurrences of communicable diseases that the Department of Health and Environmental Control, DHEC, requires to be reported in its school exclusion list. So everything that is in the school exclusion list must be reported to us and to parents. So if the child care facility comes in with a case of chickenpox, someone comes in there and they have chickenpox, and that has to be reported to us, but that also has to be reported to the parents within 48 hours after the occurrence. So there is a time factor for that as well. Now, they also have things that they must report immediately as well. But all of those things are outlined in the guidance, in the regulation for child care facilities.
Okay, thank you for that.
Yes.
One of the things that I wanted to also ask about was, if parents, and this is again to you, Ms. Lara, if parents have concerns about COVID outbreaks, or they have concerns that maybe the center isn't following the best practices, who do they contact with that information? Where do parents need to go for that?
So ordinarily, I think in my presentation, I listed all of the regional offices and all of the counties that the regional office monitors. So they can reach out to the regional supervisor in the regional office, or, they can reach out to me. I respond to lots of parent inquiries, and I'm happy to take any information that someone wants to provide to me. You know, I can be reached at cynthia.lara@dss.sc.gov. That's my email address to me personally. And it's always best to try to email me because telephone is hit and miss. So because I'm in and out. So, you know, I try to listen to them, but the quickest way to reach me is cynthia.lara@dss.sc.gov with any inquiries about COVID or treatment of children or whatever complaints, whatever they may have at their childcare facility. And me and my team will research those, and I'll have someone to investigate it if it's regulatory.
All righty. Well, thank you for that. So we are, well, I was about to say, I was about to give you the last call for questions, and then one came in. So hold on one second. What can we do as parents to better support school teachers encouraging our special needs kids keeping their mask on? So how can we encourage teachers to help our little folks keep their mask on, our special needs kids?
So I think the biggest thing there is practice. I have had some families, I have a very large proportion of my patients have significant special healthcare needs. And I have got some kids, particularly with autism, who have had a really hard time figuring out how to wear a mask, how to keep it on. And in some cases, what we've done is we've had their ABA therapists really devote a lot of time to working on mask wearing with them, and it's worked. And interestingly, I now have a couple that have gotten so good with their masks that now they don't want to take them off. So you can kind of go from one extreme to the other extreme, but I'll take that any day of the week. I really do think that for kids with special needs, it comes down to practice. It comes down to encouragement, positive reinforcements, always good. Negative reinforcement, probably not so much, not going to get anywhere with that at all. Certainly, I think having the teacher do the same thing, particularly if the kid is getting some ABA in school or any kind of therapy in school, having occupational therapists work with masks as well, I think can be a good thing, just as far as the child being able to get it on and off, fine motor skills. But I think it is just repetition, support, and understanding that it's not going to be perfect initially, that it's, but particularly for kids who really struggle, really have sensory issues, it's going to be a work in progress for a while, and that's okay.
All righty. Well, this is the official last call because we are at the minute. So if I don't see anything else come in, I don't want to stifle anybody's burning questions, but I definitely want to say thank you so much for you all taking the time to have this conversation with us. It is very important. And we just, folks have so many questions. So thank you all so much for the opportunity. We want to thank you all for attending and devoting a little bit of your evening to us. And everything's good to go. So I think we're going to end it here. And once again, thank you so much, Ms. Lara, and thank you so much, Dr. Greenhouse, for taking the time to talk with us today. And you all have a wonderful evening. And if you're having dinner, enjoy your dinner.
Thank